today's video we are going to discuss regarding when should you change your breast implants. Hello friends, I'm Dr. Samir. I'm a board certified cosmetic and plastic surgeon. I do practice in Mumbai and Goa. In my practice of 15 years, the most common question which is asked to me is by a patient who is looking for breast implants or who has already done breast implant is, when should I change my breast implants? They do ask me, it's more than 10 years, should I change it now? So we'll discuss regarding this in today's video. The true answer to this question is, if you do like your breast, if you are happy with your size, there is no sagging, no drooping, your breasts are not loose and you are not having any complaints, then there is no need to change the implants, even if it is more than 10 years. That is the first thing. It's not like tires in which automatically after certain mileage you are supposed to change it. So breast implants, you can keep it till you are having any issues with the implant. So when should you change, or what are the reasons in which you need to change your implants? Breast implant exchange is a very common procedure and I do it very often. And the most common reason for me, my patients complain to me, is they are tired of their size. For example, they want it to be more bigger or they want it to be smaller. This is the most common reason, followed by some patients asking me to remove the implants because they have already gained the size because of pregnancy or because of massive weight gain, and they are now happy with the size what they are having and they want to get rid of the implant. The second indication is capsular contracture. Obviously, when we put an implant, there is a capsule formation around your implant, and if this capsule becomes thick, then your implant might override, or it might become high, or it might become low, or it might get displaced. So this is the second reason why we do change implant. The third reason is rippling. Sometimes you do feel some ripples over the implant. This is very uncommon, but then if this happens, there is no need to change. The first option what we give them is, we'll change the pocket. For example, if it's above the muscle, we'll go below the muscle, or we'll change the plane. Second thing is, we might inject some fat so that rippling is taken care and it's not palpable. And obviously the third option is to put a new implant. And the fourth reason is, if they are looking for any additional breast procedure. For example, if they are looking for some kind of lift, for example a circumareolar or a lollipop kind of lift, and plus to that, if they are looking for a mastopexy with a mesh or that kind of thing, then we do advise them, you can either change your implants, go for a new fresh pair. So finally it comes down to three things: your breast size, your breast shape, and are you happy with your breast, and what kind of breast, or where do you want your breast to be after putting the implants. So if you're having issues with any of the factor, then do come to us. We'll evaluate you and we'll plan accordingly and suggest you the best procedure. Thank you.